Welcome, future nurses, to NCLEX Practice Test 29. This isn't just another set of questions. This is your opportunity to stretch your limits, sharpen your critical thinking, and train your brain exactly the way the NCLEX will challenge you on exam day. One test more to reach your past results. Before we jump into the first question, I want to speak directly to you. Because if you've been studying hard for NCLEX but still feel overwhelmed, exhausted, or unsure whether you're heading in the right direction, then pay close attention. After just a couple more practice tests, you'll notice a transformation. You'll be operating on a whole new level of confidence and competence. This online NCLEX crash course is precisely the missing link you've been searching for. Right now, it's available at an incredible 70% off, and it's the exact same program that has helped over 10,000 nursing students pass NCLEX on their very first attempt. Here's what you'll get: live interactive classes where your doubts are answered instantly, unlimited access to recorded lectures for anytime revision, crystal clear PDF notes covering every high-yield topic, over 5,000 previously asked NCLEX questions, detailed NGN case discussions with comprehensive explanations, and a step-by-step daily study planner, so you never waste time wondering what to study next. This isn't just a course, it's a complete NCLEX success system. You've been searching for the right guidance, and here it is. Don't let another exam season slip away. Click the enrollment link in the description and let's conquer NCLEX in one attempt together. Let us start with the very first question. During a verbal handoff report for a newly admitted medical surgical client, the nurse must decide which piece of information is the most essential for the receiving nurse to know. The options given are A. List of medications that have already been discontinued, B. The client's involuntary admission status, C. The client's food preferences and meal timings, and D. Whether family members are currently present at the bedside. The correct answer is option B. The client's involuntary admission status. This is because admission status carries critical safety and legal implications. Clients admitted involuntarily may attempt to leave against medical advice or pose risk to themselves and others, so the nurse must be aware to enforce safety precautions like elopement protocols and closer monitoring. On the other hand, discontinued medications, food preferences, or family presence are supportive details but not urgent for immediate safe care. Question 2. Moving on, the next question asks about oral care for a client with stomatitis. The options presented are A. Use alcohol-based mouthwash for rinsing, B. Cleanse with lemon glycerin swabs between meals, C. Rinse mouth with saline solution and spit, and D. Rinse mouth with chlorhexidine regularly. The correct answer is option C. Rinse mouth with saline solution and spit. Saline, or saline mixed with sodium bicarbonate, is the safest and most effective rinse because it soothes inflammation, maintains moisture, and prevents further irritation. By contrast, alcohol-based rinses and lemon glycerin swabs cause dryness and discomfort, while chlorhexidine may alter taste and irritate fragile mucosa, so they are not considered first line. Question 3. Now let us turn to a question on infection. A client is admitted with suspected osteomyelitis, and the nurse considers which laboratory test is most likely to be ordered. The options include A. Erythrocyte sedimentation rate, B. Serum potassium, C. Serum creatinine, and D. Prothrombin time. The correct answer is option A. The erythrocyte sedimentation rate, or ESR. This test is a sensitive marker of inflammation, and in bone infections like osteomyelitis, it is usually elevated and helps monitor the response to treatment. In contrast, potassium levels only measure electrolytes. Creatinine reflects kidney function, and prothrombin time evaluates clotting ability, none of which help confirm a bone infection. Question 4. Shifting gears, the next question focuses on medication teaching. During discharge teaching for a client prescribed propylthiouracil, or PTU, the nurse must evaluate which statement shows correct understanding. The available options are A. I should eat more iodine-rich foods, B. This drug may cause my urine to turn red, C. I will need liver enzyme tests while on this drug, and D. If the drug works, I should lose more weight. The correct answer is option C. I will need liver enzyme tests while on this drug. This is because PTU carries the risk of hepatotoxicity, so monitoring liver function is absolutely essential. Choosing iodine-rich foods would worsen hyperthyroidism. Red urine is linked with phenazopyridine, not PTU, and successful treatment of hyperthyroidism usually stabilizes metabolism. which often leads to weight gain rather than further weight loss. Question 5. To continue this section, let us look at a case of acute heart failure. A client presents with shortness of breath, frothy pink sputum, crackles, and weak pulses. The nurse must decide which provider order should be questioned. The options are A. Oxygen via mask or nasal cannula, B. Losartan, C. Fowler's position, and D. Diltiazem. The correct answer is option D. Diltiazem. Calcium channel blockers like diltiazem reduce myocardial contractility, which worsens acute systolic heart failure and pulmonary edema. Oxygen, losartan, and Fowler's position are all appropriate supportive measures. To highlight the clinical pearl here, Stancoast Pearl reminds us that in acute decompensated heart failure, avoid drugs that depress contractility, such as non-dihydropyridine calcium channel blockers and some beta blockers. Instead, the priorities are oxygen, diuretics, vasodilators, and afterload-reducing agents like angiotensin receptor blockers or ACE inhibitors. Question 6. Shifting gears to obstetrics, consider a 39-week pregnant client whose membranes rupture spontaneously while ambulating. After the client returns to bed, what should be the nurse's first action? The choices are A. Assess the color of the amniotic fluid, B. Perform a vaginal examination for cervical dilation, C. Place the client on strict bed rest, or D. Assess fetal heart tones. The correct answer is option D. Assess fetal heart tones. This must come first because rupture of membranes increases the risk of cord prolapse, compression, and hypoxia. An immediate assessment of fetal well-being is crucial. The color of the fluid, cervical checks, and bed rest are secondary priorities. As a key reminder, Stancoast Pearl tells us that after rupture of membranes, the golden rule is baby first. Always check fetal heart tones before anything else, then proceed to fluid assessment for color, amount, and odor. Question 7. Next, let us move to a gastrointestinal complication. A client with ulcerative colitis has elevated serum osmolality and urine-specific gravity. Which complication does this suggest? The options are A. Renal insufficiency, B. Diabetes insipidus, C. Hypoaldosteronism, or D. Fluid volume deficit. The correct answer is option D. Fluid volume deficit. Severe diarrhea in ulcerative colitis leads to dehydration, producing concentrated blood and concentrated urine. Renal insufficiency, diabetes insipidus, and hypoaldosteronism do not match this specific lab pattern. To drive the point home, Stancoast Pearl emphasizes that in ulcerative colitis exacerbations, dehydration is the #1 complication. Lab patterns of high serum osmolality and high urine, specific gravity signal fluid deficit, and prompt intravenous fluids can be life-saving. Question 8. Moving into pediatrics during infant cardiopulmonary resuscitation, the nurse must decide which pulse to check for circulation. The options are A. Carotid, B. Brachial, C. Pedal, and D. Radial. The correct answer is option B. The brachial pulse. This is the most reliable in infants because it is central and easily accessible, unlike carotid, pedal, or radial pulses, which may be weak or difficult to locate. To make this unforgettable, Stancoast Pearl reminds us that in CPR, adults require carotid pulse checks, children can be assessed at the carotid or femoral, and infants should always be checked at the brachial artery. Before we continue, let me speak directly to you. Yes, the dedicated future nurse working tirelessly right now. I know the late nights, the stress, the fear that maybe you're not ready. But here's the truth. You can do this, and your dream is closer than you think. Right now, Stancoast Coaching is offering 70% off our online NCLEX crash course, the same program that has helped over 10,000 students pass NCLEX on their first try. You'll get interactive live sessions, recorded lectures for anytime review, comprehensive PDF notes, over 5,000 NCLEX-style questions, NGN case discussions, and a clear daily study plan. Imagine the moment you hold your nursing license, share your success with family, and say, "I made it." That day can be yours. Click the link now, claim your 70% discount, and let's make your NCLEX success a reality. Together. Question 9. Transitioning into acid-base balance. Here is a case involving arterial blood gases. The ABG results are pH 7.62, PaCO2 19 millimeters of mercury, bicarbonate 24 milliequivalents per liter, and PaO2 85 millimeters of mercury. How should these results be interpreted? The options are A. Compensated metabolic acidosis, B. Uncompensated metabolic acidosis, C. Compensated respiratory acidosis, or D. Uncompensated respiratory alkalosis. The correct answer is option D. Uncompensated respiratory alkalosis. The pH is alkalotic, the carbon dioxide is low, indicating a respiratory cause, and the bicarbonate is normal, showing no metabolic compensation. As a simple but powerful tool, Stanko's Pearl advises using a 3-step method. First, look at pH. Second, identify the abnormal PaCO2 or bicarbonate. And third, decide if compensation is present. Hyperventilation is the classic cause of uncompensated respiratory alkalosis. Question 10. Now, let us consider obstetric emergencies. In a client with a prolapsed umbilical cord, which fetal heart rate pattern is most likely to be seen? The choices are A. Early decelerations, B. Variable decelerations, C. Late decelerations, or D. Normal variability. The correct answer is option B. Variable decelerations. Cord compression produces abrupt and inconsistent drops in fetal heart rate. Unlike early decelerations from head compression, late decelerations from utero-placental insufficiency, or normal variability. To reinforce best practice, Stanko's Pearl reminds us that prolapsed cord is a true emergency. Variable decelerations or bradycardia are classic findings, and immediate interventions include knee-chest positioning, lifting the presenting part off the cord, stopping oxytocin, providing oxygen, and preparing for cesarean delivery. Question 11. Finally, let us jump the section with nursing documentation. When completing an incident report about a client fall, which entry would be inappropriate? The options are A. The client's statement about how the fall occurred, B. The nurse's opinion about why the fall occurred, C. The injuries observed, or D. The names of witnesses. The correct answer is option B. The nurse's opinion about why the fall occurred. Incident reports must be objective and factual, so opinions or judgments are not appropriate. Client quotes, observed injuries, and witness names are all valid. To seal this lesson, Stanko's Pearl emphasizes that incident reports are never part of the medical record. They must contain only facts: what happened, when, where, injuries sustained, witnesses present, and immediate interventions. Question 12. Moving this section with an urgent safety scenario. The nurse notices a fire starting in a client's room. After safely rescuing the client, the question is, what should come next? The options are A. Activate the fire alarm, B. Attempt to extinguish the fire, C. Notify the nursing supervisor, or D. Close the client's door. The correct answer is option A. Activate the fire alarm. This step mobilizes the emergency response team immediately, protecting clients and staff by following the RACE protocol: rescue, alarm, contain, extinguish. Extinguishing the fire may be attempted later if it is small, while calling a supervisor or closing the door delays the system-wide response. To keep this crystal clear, Stanko's Pearl reminds us to always remember RACE in fire safety. Rescue the client, sound the alarm, then contain by shutting doors, and only if safe, attempt to extinguish. Question 13. Shifting on to the postoperative setting, an 88-year-old client is just 15 minutes post-total hip arthroplasty. The nurse must decide which assessment is the top priority. The options are A. Range of motion, B. Urinary output, C. Vital signs, or D. Incision site. The correct answer is option C. Vital signs. Immediately after surgery, the greatest danger is shock or hemorrhage, and monitoring blood pressure and heart rate provides the earliest warning of instability. Assessing range of motion is important later in rehabilitation. Urinary output may reflect anesthesia effects, and the incision site can be monitored after systemic stability is ensured. To emphasize this point, Stanko's Pearl tells us that in the immediate post-op period, airway, breathing, circulation, and vital signs always outweigh site-specific checks. Question 14. Transitioning to liver disease, consider a client with cirrhosis prescribed lactulose. Which finding tells the nurse the drug is working? The options are A. Increased liver enzyme levels, B. Improved level of consciousness, C. Decreased urinary calcium, or D. Increased gastric pH. The correct answer is option B. Improved level of consciousness. Lactulose reduces ammonia absorption by trapping it in stool, and improvement in mental status reflects reduced hepatic encephalopathy. Elevated liver enzymes indicate ongoing injury, calcium excretion is not affected, and gastric pH remains unchanged. To anchor this in memory, Stan Coast-Pearl explains that in cirrhosis with encephalopathy, mental status, not liver enzyme levels, is the best measure of lactulose effectiveness. The therapeutic goal is 2 to 3 soft stools daily to clear ammonia. Question 15. Now shifting focus to ethical nursing practice, imagine applying soft limb restraints to a client. Which nursing action takes priority? The options are A. Update the client's family about the restraint. B. Check the client's blood pressure and pulse. C. Offer food and fluids before applying restraints. Or D. Explain to the client why restraints are being used. The correct answer is option D. Explain to the client why restraints are being used. This preserves dignity, trust, and legal compliance by ensuring the client understands the reason and conditions for removal. Informing the family, checking vital signs, or offering food and fluids are all appropriate but secondary to explanation. To ensure safe and ethical care, Stan Coast-Pearl reminds us, before restraints, explain, document, and obtain a provider's order. After restraints, check skin, circulation, and vital signs every 15 to 30 minutes. Question 16. Switching into a calculation problem, a provider prescribes 150 milliliters of sterile water to infuse over 1 hour with tubing that has a drop factor of 15 drops per milliliter. How many drops per minute should the nurse set? Using the standard formula, volume multiplied by drop factor divided by time in minutes, we calculate step by step. First, 150 milliliters times a drop factor of 15 equals 2,250. Next, divide 2,250 by 60 minutes, which gives 37.5. When rounded, that becomes 38 drops per minute. Therefore, the correct answer is 38 drops per minute. This rate ensures accurate delivery of fluid without the risk of underinfusion or overinfusion. Question 17. Moving on to pediatric emergencies, the nurse finds a 7-year-old child who is pulseless. After calling a code blue, what comes next? The options are A. Perform CPR with a 15:2 compression ventilation ratio for 2 minutes. B. Leave the child to obtain an AED, then start CPR at 30:2. C. Perform CPR with a 30:2 ratio for 2 minutes. Or D. Start an IV line for epinephrine. The correct answer is option C. Perform CPR with a 30:2 ratio for 2 minutes. A single rescuer for a child follows adult ratios of 30 compressions to 2 breaths, while 2 rescuers would use 15:2. Leaving the child for an AED delays CPR and IV access is advanced life support, not immediate. To master this skill, Stan Coast-Pearl points out that in pediatric arrest, 1 rescuer uses 30:2, 2 rescuers use 15:2, compression depth is 1.5 inches in infants and 2 inches in children, and the sequence follows CAB, compressions, airway, breathing. Question 18. Let us consider infection control. A client in the emergency department presents with fever, irritability, and nuchal rigidity. What is the nurse's first action? The options are A. Administer ibuprofen. B. Place the client on droplet precautions. C. Notify the public health department. Or D. Obtain blood cultures. The correct answer is option B. Place the client on droplet precautions. This is the hallmark presentation of bacterial meningitis, which spreads easily by droplets. Infection control prevents transmission before further interventions. Antipyretics reduce fever but do not stop spread. Cultures guide therapy but come later. And public health notification is important but not immediate. Question 19. Let us begin with a question on crutch walking. A nurse observes a client ambulating with crutches using the 3-point gait. Which finding requires follow-up? The options are A. Client places crutches 15 centimeters in front and to the side before walking. B. Client advances both crutches with the injured leg, then moves the non-injured leg. C. Client keeps elbows flexed 15 to 30 degrees while bearing weight through hand grips. And D. Client moves a crutch at the same time as the opposite leg. The correct answer is option D because this describes a 2-point gait, not a 3-point gait, and it is inappropriate for a client who has a non-weight-bearing extremity. Option A is correct technique for crutch placement. Option B correctly describes the 3-point gait, and option C is also proper because weight must be borne through the hands, not the axilla. Question 20. Moving on to the next scenario. A client is admitted with Pseudomonas aeruginosa pneumonia. Which nursing intervention is most appropriate to include in the care plan? The options are A. Require N95 mask use when ambulating. B. Initiate IV access and encourage oral fluids. C. Obtain daily weights every morning. And D. Administer oseltamivir within 48 hours. The correct answer is option B, because Pseudomonas pneumonia is bacterial, requiring IV antibiotics and hydration to thin secretions. Option A is incorrect since droplet precautions are enough. Option C is more appropriate for renal or cardiac patients. And option D is incorrect because oseltamivir is an antiviral, not a treatment for bacterial pneumonia. Stan Coast. Pearl. Think of bacterial pneumonia priorities as IV antibiotics, hydration, and pulmonary hygiene. Hey, future nurse. Yes, I'm talking to you. I know it hasn't been easy. Long study hours, moments of doubt, wondering if all this effort will ever pay off. But here's the exciting part. It will. Stan Coast Coaching is giving you 70% off our online NCLEX crash course, the very course that has helped over 10,000 nursing students pass NCLEX on their very first attempt. With live interactive classes, anytime access recorded lectures, high-yield PDF notes, thousands of practice questions, NGN case breakdowns, and a daily plan that tells you exactly what to study, everything is set for your success. Picture walking out of the exam center, license in hand, smiling with pride. That's possible, right now. Click the link, grab your 70% discount, and let's achieve NCLEX success together. Question 21. Shifting focus to ostomy care. A client with an ileostomy reports embarrassment due to foul odor. Which food should the nurse recommend avoiding? The options are A. Buttermilk, B. Parsley, C. Yogurt, and D. Eggs. The correct answer is option D because eggs are known to cause foul-smelling gas and stool, worsening odor. Buttermilk, parsley, and yogurt, on the other hand, are odor-reducing foods. Point to remember. For ileostomy care, teach clients that foods like eggs, fish, and cabbage worsen odor, while yogurt, parsley, and buttermilk help reduce it. Question 22. Now let us consider infection control delegation. The infection control nurse wants to reduce hospital-acquired infections. Which task can be delegated to an unlicensed assistive personnel? The options are A. Educating staff about preventing bloodstream infections, B. Demonstrating proper hand washing to visitors, C. Restocking personal protective equipment, and D. Screening visitors for respiratory infections. The correct answer is option C because restocking supplies is appropriate for a UAP. Options A and B involve teaching, and option D requires clinical assessment, which are within the nurse's role. Here is Stan Coast Pearl. A simple rule of delegation is that UAPs may assist, but nurses must assess, teach, and use judgment. Question 23. Turning to parental education, a postpartum nurse is teaching parents of an infant diagnosed with microcephaly. Which parental statement indicates a need for further teaching? The options are A. I understand that microcephaly may cause an abnormally small head size. B. Microcephaly is always caused by genetic factors. C. I will ensure our baby receives regular developmental assessments. And D. Infections during my pregnancy may have caused microcephaly. The correct answer is option B, because microcephaly can also result from infections, toxins, and malnutrition. Not only genetics. The other statements are accurate. See this Stan Coast. Pearl. Microcephaly means impaired brain growth and can be genetic, environmental, or infection-related. So monitoring development is critical. Question 24. Continuing on, a nurse educates a client newly diagnosed with Cushing's disease. Which client statement requires follow-up? The options are A. I will need to eat more potassium-rich foods. B. I will need more steroids during periods of stress. C. I will be at a higher risk for an infection. And D. I should do weight-bearing exercises. The correct answer is option B, because stress-dose steroids are required in Addison's disease, not Cushing's. The other options are appropriate teachings for Cushing's complications. Question 25. Let us shift our focus to postpartum laboratory values. A nurse is reviewing the results for a client who is 24 hours after a vaginal birth. The question is, which of these findings requires follow-up? The options are Option A, hematocrit 46%. Option B, creatinine 1.0 milligram per deciliter. Option C, platelets 90 times 10 to the power of 9 per liter. Option D, white blood cells 17 times 10 to the power of 9 per liter. The correct answer is option C, platelets 90 times 10 to the power of 9 per liter. A platelet count below 150,000 indicates thrombocytopenia, which puts the client at risk for bleeding. This is the abnormal result that needs immediate follow-up. The other values are expected in the postpartum period. Hematocrit of 46% is within normal limits. Creatinine at 1.0 mg per deciliter is also normal. White blood cells at 17 times 10 to the power of 9 per liter may seem high, but it is actually common after childbirth due to the body's natural stress response. Question 26. Now, let us consider medication safety in pregnancy. A client with hyperemesis gravidarum is given Ondansetron. Which serious side effects should the nurse monitor for? The options are A. Continued nausea and vomiting, B. Prolonged QT interval, C. Respiratory distress, and D. Constipation. The correct answer is option B, because Ondansetron may prolong QT interval, leading to life-threatening arrhythmias. The other options are either minor or unrelated. Stand-Coast, Pearl. Always monitor ECG for clients on Ondansetron, particularly if they have other risk factors for arrhythmias. Question 27. Moving into ophthalmology, a client has acute angle closure glaucoma. Which prescription should the nurse anticipate? The options are A. Timolol, B. Hydroxyzine, C. Phenylephrine, and D. Imipramine. The correct answer is option A. Timolol, because it rapidly reduces intraocular pressure. The other medications either worsen glaucoma or have no therapeutic role. Stand-Coast, Pearl. In glaucoma emergencies, timolol and acetazolamide are mainstays, and anticholinergics are dangerous. Question 28. Next, let us look at pre-procedure teaching for a client scheduled for colposcopy with biopsy. Which statement should be included? The options are A. You should not eat or drink for 8 hours before the test. B. You will need someone to drive you home after the test. C. A metallic taste is common because of contrast dye. And D. Vaginal intercourse may be painful after the procedure. The correct answer is option D, because mild pain is normal when intercourse resumes after pelvic rest. The other statements are inaccurate since no sedation, fasting, or contrast dye is involved. Stand-Coast, Pearl. Teaching includes no fasting, no sedation, mild spotting, and pelvic rest for 48 hours. Question 29. Shifting gears to prioritization, the emergency department nurse is caring for multiple clients. One witness informed consent for a client scheduled for surgery in 6 hours. 2. Assess blood pressure for a client on a dopamine infusion. 3. Administer prescribed magnesium sulfate. Infusion for a client with status asthmaticus. 4. Dress wounds for a discharged client with lacerations. 5. Insert a peripheral IV and start fluids for a client with mild dehydration. The actions should be performed in the order 3 to 2 to 5 to 1 to 4. The tasks are 1. Witness informed consent for a client scheduled for surgery. 2. Assess blood pressure for a client on a dopamine infusion. 3. Administer magnesium sulfate for a client with status asthmaticus. 4. Dress wounds for a discharged client. And 5. Insert IV fluids for mild dehydration. The correct order places status asthmaticus first because it is life-threatening, followed by blood pressure monitoring, then IV fluids, then consent, and finally, wound care. Stand-Coast, Pearl. Always prioritize airway and circulation before documentation and stable care. Question 30. Finally, let us examine lithium safety. Which client is at greatest risk for toxicity? The options are A. A client with asthma using bronchodilators. B. A client with migraines recently started on naproxen. C. A client with hypertension on a clonidine patch. And D. A client with hypothyroidism taking levothyroxine. The correct answer is option B, because NSAIDs like naproxen reduce renal clearance of lithium, causing toxicity. The other medications do not increase toxicity risk. Stand-Coast, Pearl. Lithium interacts with NSAIDs, ACE inhibitors, and diuretics. Advise acetaminophen instead for pain management. Question 31. Let us begin with concussion assessment. A nurse is caring for a client who has sustained a concussion. Which finding indicates a complication that requires urgent intervention? The options are A. Reports of persistent headache. B. Glasgow Coma Scale of 13. C. Heart rate of 56. And D. Drowsiness. The correct answer is option C, because a heart rate of 56 indicates bradycardia, which is a sign of increased intracranial pressure. This is part of the Cushing reflex, a life-threatening late sign of brain injury. Option A, persistent headache, is common after concussion and not always alarming. Option B, a Glasgow coma scale of 13, shows mild impairment but is not critical unless worsening. Option D, drowsiness, may be expected post-concussion unless the client cannot be aroused. Question 32. Shifting to pediatric emergencies, a nurse assesses an infant who is cyanotic, apneic, and has a heart rate of 50 beats per minute. What is the nurse's first action? The options are A, start chest compressions, B, notify the code or rapid response team, C, deliver rescue breaths, and D, obtain IV access. The correct answer is option B, because the very first step in infant cardiac arrest is to call for help and activate the code team. This ensures resuscitation support and equipment arrive promptly. Option A, chest compressions, follow immediately after help is called. Option C, rescue breaths, are performed as part of CPR but are not the immediate first action in a single rescuer scenario. Option D, obtaining fourth access, is important later for drug administration, but not the first priority. Stancoast. Pearl. In pediatric basic life support, always call for help first, then begin CPR. If the heart rate is less than 60 with poor perfusion, treat it as cardiac arrest. Question 33. Now let us focus on advocacy in pain management. A client transferred from the PACU reports severe pain despite having received pain medication 1 hour ago, and the next dose is not due for 2 hours. How should the nurse best act as a patient advocate? The options are A, contact the physician for more effective pain management, B, encourage non-pharmacological strategies, C, explain that giving medication too soon can be dangerous, and D, provide a quiet environment for rest. The correct answer is option A, because advocacy means speaking up for the client's unmet needs and ensuring adjustments to pain management orders. Option B, using non-drug methods, may help but is not sufficient when pain is severe. Option C is educational but does not address the pain. Option D, providing rest, is supportive but not advocacy. Question 34. Turning our attention to musculoskeletal infections, which nurse statement indicates correct understanding about acute osteomyelitis? The options are A, IV antibiotics are usually needed for only 7 to 14 days. B, the most common cause is viral infection. C, a significant fever, usually greater than 101 degrees Fahrenheit, is common. And D, petechiae of the extremity is often seen. The correct answer is option C, because fever, bone pain, swelling, and decreased limb function are hallmarks of acute osteomyelitis. Option A is wrong since therapy usually lasts 6 to 12 weeks with IV antibiotics. Option B is incorrect because bacterial causes, especially Staphylococcus aureus, are most common. Option D is also incorrect because petechiae are more associated with fat embolism. Question 35. Moving into cardiac emergencies, a client with acute myocardial infarction is being treated in the emergency department. Which intervention should the nurse anticipate as emergent? The options are A, exercise electrocardiography or stress test, B, chest CT with contrast, C, percutaneous coronary intervention, and D, echocardiogram. The correct answer is option C, because PCI, also called angioplasty with stent placement, restores coronary blood flow and is the gold standard emergency treatment if performed within 90 minutes. Option A, a stress test, is contraindicated in acute MI. Option B, a CT scan, does not treat the occlusion. Option D, an echocardiogram, helps with structural assessment but not acute intervention. Before the next question, take a moment for yourself. Future nurse, I know you've been pushing yourself harder than ever. The endless pressure, the doubts, the fear of failure, it's real. But here's the truth. Success is closer than you think. Stancoast Coaching is offering 70% off our online NCLEX crash course, the exact program trusted by over 10,000 students to pass NCLEX on their first try. Get live interactive sessions, recorded lectures, detailed PDF notes, 5,000 plus practice questions, NGN case studies, and a daily study roadmap. Imagine the joy of holding your RN or PN license, telling everyone, I did it! That moment can be yours sooner than you expect. Don't wait. Click the link, claim your 70% discount, and let's make your NCLEX dreams come true. Question 36. Switching focus to delegation, a nurse manager reviews tasks given to an unlicensed assistive personnel. Which task should the manager question? The options are A. Giving perineal care to a client with a urinary catheter, B. Performing passive range of motion exercises, C. Reminding a client how to manage a colostomy, and D. Ambulating a client using a gait belt. The correct answer is option C, because colostomy education and reinforcement require nursing judgment and cannot be delegated. Option A is appropriate since catheter-related perineal care is routine hygiene. Option B is acceptable as UAPs can assist with range of motion. Option D is also allowed since UAPs can ambulate stable clients with a gait belt. Question 37. Now let us review a leadership scenario. A nurse manager notices that a staff nurse frequently returns late from lunch breaks. What should the manager do first? The options are A. Continue observing the pattern, B. Write a formal reprimand, C. Ask the nurse to check in and out for meals, and D. Talk with the nurse about the impact of tardiness. The correct answer is option D, because the initial step in progressive discipline is to address the behavior directly and explain its effect on the team and patient care. Option A delays intervention, option B is premature, and option C is unnecessarily punitive without prior discussion. Question 38. Moving along to respiratory care, a client on mechanical ventilation is receiving positive end expiratory pressure, also called PEEP. What is the primary purpose of this setting? The options are A. To provide a fixed pressure during inspiration, B. To keep small airways and alveoli open at the end of exhalation, C. To allow spontaneous breaths between ventilator-delivered ones, and D. To ensure a preset tidal volume with each breath. The correct answer is option B, because PEEP keeps alveoli open after exhalation, improves gas exchange, and is especially important in ARDS. Option A refers to pressure support, not PEEP. Option C describes SIM-V or AC modes. Option D refers to assist control ventilation, not PEEP. Question 39. Finally, in this set, let us focus on pediatric post-operative care. A 12-year-old child 2 days after open-heart surgery refuses ambulation or physical therapy. What should the nurse assess first? The options are A. Ask parents to stress the importance of activity, B. Plan therapy before meals, C. Check if the child is experiencing pain or discomfort, and D. Let the child choose when to ambulate. The correct answer is option C, because untreated pain is the most common reason children refuse to participate in mobility after surgery. Option A may create conflict, option B may help routine but not if pain persists, and option D allows autonomy but does not address the underlying problem. Question 40. To begin this set, let us discuss mental health support. Why are crisis helplines considered critically important in mental health care? The options are A. They arrange nurse home visits, B. They provide structured follow-up planning, C. They are a free source for building coping strategies, and D. They can be life-saving for individuals in severe crisis. The correct answer is option D, because helplines provide immediate and anonymous support that may prevent suicide or self-harm during emotional breakdowns. Option A is incorrect as helplines do not arrange home visits, though emergency services may be contacted. Option B is wrong since follow-up is not their primary role, and option C is incorrect because coping skill development happens later in therapy. Stancoast Pearl. Crisis helplines are a bridge of survival. They stabilize clients in the moment and connect them to long-term care. Question 41. Moving forward to obstetrics. During a shift handover, which laboring client should the nurse assess first? The options are A. A primigravida at 39 weeks with fetal heart rate 90 to 100 beats per minute, B. A multipara at 41 weeks in early labor with a history of rapid delivery, C. A multipara at 37 weeks in active labor with 2 previous cesarean deliveries, and D. A multipara at 38 weeks in early labor with 3 centimeters dilation. The correct answer is option A, because a fetal heart rate less than 110 indicates bradycardia and possible fetal distress. Option B is not urgent since she is in early labor. Option C is concerning for rupture risk, but without distress signs. Option D is stable with no complications. Stancoast Pearl. In prioritization, fetal distress always overrides maternal history. Abnormal fetal heart rate requires immediate action. Question 42. Next, let us turn to gastrointestinal emergencies. A client with appendicitis reports sudden relief after hours of severe abdominal pain. What should the nurse do first? The options are A. Notify the physician immediately. B. Record the finding in notes. C. Start intravenous access. And D. Give a laxative for relief. The correct answer is option A, because sudden pain relief may indicate appendix rupture and risk of peritonitis. Option B is secondary. Option C is supportive, but comes after provider notification. And option D is dangerous since laxatives increase rupture risk. Stand coast. Pearl. In abdominal pain, beware of the silent danger. Pain that suddenly disappears may mean rupture, not recovery. Question 43. Shifting into allergy recognition. Which client statement suggests possible latex allergy before surgery? The options are A. I get rashes when I wear wool sweaters. B. Some soaps make my hands itchy. C. I feel tingling in my mouth after eating bananas or kiwis. And D. I vomited after taking codeine last year. The correct answer is option C, because latex proteins cross-react with foods like bananas, kiwis, avocados, and chestnuts. Option A suggests wool irritation, option B suggests soap sensitivity, and option D describes drug intolerance. Stand coast, Pearl. Always remember, fruit latex syndrome, bananas, kiwis, and avocados are classic red flags for latex hypersensitivity. 44. Continuing on to pharmacology in adolescence, a teenager has recently started guanfacine. Which finding shows the medication is working? The options are A. Stable euthymic mood. B. Reduced social anxiety. C. Better academic performance. And D. Absence of suicidal thoughts. The correct answer is option C, because guanfacine improves attention and concentration, leading to improved school performance in ADHD. Option A refers to mood stabilizers, option B to SSRIs, and option D is unrelated. Stand coast. Pearl. Think of guanfacine as a focus enhancer for ADHD, but warn about sedation, hypotension, and the need for slow tapering to avoid rebound hypertension. Question 45. Let us now consider newborn cardiac assessment. A nurse finds bounding brachial pulses with pale, cold feet and delayed capillary refill. The options are A. Tetralogy of Fallot. B. Hypoplastic left heart syndrome. C. Coarctation of the aorta. And D. Transposition of the great arteries. The correct answer is option C, because coarctation causes strong upper extremity pulses with weak or absent lower extremity pulses. Option A typically causes cyanosis and TET spells. Option B leads to systemic shock and cyanosis rather than limb differences. Option D causes profound cyanosis from birth, not pulse discrepancies. Stand coast, Pearl. Always compare upper and lower limb pulses in newborns. Differences may be the earliest clue to coarctation of the aorta. Question 46. Transitioning into infection control, the charge nurse responds to an influenza outbreak in a long-term care facility. Which intervention is most effective? The options are A. Having clients wear N95 masks while ambulating. B. Placing air purifiers in the corridors. C. Obtaining prescriptions for antivirals for those infected. And D. Isolating those infected using droplet precautions. The correct answer is option D, because influenza spreads by droplets, and isolating infected clients with surgical mask precautions is key. Option A is incorrect, since N95s are for airborne diseases, like tuberculosis. Option B is helpful for general air, but not for flu spread. Option C supports treatment but does not stop transmission. Stand coast. Pearl, in flu outbreaks, droplet precautions come first. Mask, isolate, and practice hand hygiene before medications or supportive care. Question 47. Now, let us examine MRI safety. A nurse supervises a student preparing a client for MRI. Which student action requires immediate follow-up? The options are A. Asking about claustrophobia. B. Instructing the client to use earplugs. C. Moving a nitroglycerin patch from the torso to the back. And D. Informing the client MRI has no radiation. The correct answer is option C, because nitroglycerin patches may contain aluminum backing that can overheat and burn during MRI, and the patch must be removed, not relocated. Option A is correct since claustrophobia should be assessed. Option B is correct because the scan is noisy. Option D is also correct as MRI uses magnets, not radiation. Stand coast. Pearl. Before MRI, always ask about implants or patches. Many contain hidden metal that poses a serious safety risk. Question 48. Finally, in this set, let us revisit lithium safety. A nurse reviews new medications prescribed for a client on lithium. Which drug should be questioned? The options are A. Venlafaxine, B. Hydrochlorothiazide, C. Gabapentin, and D. Verapamil. The correct answer is option B, because thiazide diuretics cause sodium loss, leading to lithium retention and toxicity. Option A may be used with caution, option C is generally safe, and option D can be used with monitoring. Stand coast. Pearl. The three big drug classes that raise lithium toxicity are thiazide diuretics, ACE inhibitors, and NSAIDs. Always watch for them. Question 49. A nurse admits a client who is blind and deaf. What is the nurse's priority? The answer choices are A. Reviewing the plan of care with the client, B. Reporting safety concerns to the nursing supervisor, C. Updating the client on available social activities, and D. Providing a safe environment for the client. The correct answer is D. Providing a safe environment for the client because when caring for clients with dual sensory impairment, the most urgent priority is safety. Since blindness and deafness significantly increase the risk of falls, injuries, and disorientation, especially in an unfamiliar hospital setting, ensuring a safe environment is crucial before addressing other needs. While reviewing the plan of care, notifying the supervisor, or promoting social engagement are all important, they are secondary to immediate safety concerns. Question 50. Moving forward, consider a client scheduled for a liver biopsy who has received pre-procedure teaching. The answer options are A. I will not be conscious during this procedure. B. I should not take any acetaminophen 1 week before this procedure. C. I will need to cough and deep breathe every 2 hours after this procedure. And D. I may be asked to hold my breath during the insertion of the biopsy needle. The correct answer is D. I may be asked to hold my breath during the insertion of the biopsy needle. This statement reflects an accurate understanding because instructing the client to hold their breath stabilizes the diaphragm and liver, minimizing the risk of injury to surrounding structures such as the lungs and preventing complications like pneumothorax. In contrast, the procedure is usually performed under local anesthesia, so the client remains awake, making option A incorrect. Acetaminophen is safe prior to the procedure, but NSAIDs and anticoagulants are contraindicated due to bleeding risk, so option B is incorrect. Finally, deep breathing and coughing immediately after the biopsy can increase intra-abdominal pressure and risk hemorrhage, which makes option C inaccurate. Future nurse, let's take a pause here. I know what you're feeling. The stress, the endless studying, the fear of failure, but I'm here to tell you, you're not alone, and you're closer than ever to your dream. Stand Coast Coaching is giving 70% off on our online NCLEX crash course, the same course that has guided over 10,000 students to pass NCLEX on their first attempt. You'll receive live classes to answer all your doubts, recorded lectures for review anytime, detailed PDF notes, over 5,000 NCLEX-style questions, NGN case study discussions, and a daily study plan. Picture the happiness when you finally say, I passed. That feeling can be yours. Click the link, secure your 70% discount, and let's achieve NCLEX success together. Question 51. Next, when planning care for a client with Mycoplasma pneumonia, the nurse must decide on the appropriate precaution. The options are A. Place the client in a private room with negative airflow, B. Wear a surgical mask within 3 feet of the client, C. Wear gloves when in contact with the client, and D. Provide disposable meal trays and utensils. The correct answer is B. Wear a surgical mask within 3 feet of the client because Mycoplasma pneumonia spreads through respiratory droplets, making droplet precautions essential. While negative airflow rooms are reserved for airborne diseases like tuberculosis, measles, and varicella, gloves are emphasized in contact precautions for infections such as MRSA or C. difficile, and disposable utensils are unnecessary for droplet precautions. Question 52. Finally, regarding immunizations, the nurse attends a continuing education program and is asked which statement reflects correct vaccine knowledge. The options include A. The measles, mumps, and rubella (MMR) vaccine is classified as a live attenuated vaccine. B. It is safe to mix certain vaccines together in the same syringe to reduce injections. C. The dorsogluteal site is an acceptable option for intramuscular immunizations. And D, clients must wait at least 2 weeks after receiving one immunization before they can get another. The correct answer is A. The measles, mumps, and rubella (MMR) vaccine is classified as a live attenuated vaccine. This is accurate because live attenuated vaccines contain weakened organisms that closely mimic natural infection, producing strong, long-lasting immunity, and include vaccines such as MMR, varicella, rotavirus, yellow fever, and intranasal influenza. Options B, C, and D are incorrect, because vaccines should never be mixed in a syringe unless pre-formulated as a combination. The dorsogluteal site is avoided to prevent sciatic nerve injury, and multiple vaccines can often be administered on the same day, with spacing required only if 2 live vaccines are not given simultaneously. Question 53. Let's start with a challenging scenario involving suspected child abuse. A nurse observes a toddler with multiple bruises at different stages of healing and several burns. The question is, what is the most appropriate nursing action? The options are A. Confront the caregiver directly. B. Call local authorities or the state child abuse hotline. C. Reassess the child in 2 weeks. And D. Notify the healthcare provider first. The correct answer is B. Call local authorities or the state child abuse hotline. This is because nurses are legally mandated reporters under the Child Abuse Prevention and Treatment Act. And any suspicion of abuse requires immediate notification to protect the child. Confronting caregivers directly, option A, could put both the child and nurse at risk, and waiting, as in option C, violates mandatory reporting laws. While notifying the provider is important, as in option D, it must not delay reporting to authorities. Question 54. Transitioning to client confidentiality. Imagine a client who wants to test for HIV without their identity being linked to the results. Which method should the nurse recommend? The options are A. At-home HIV self-testing kit. B. Rapid testing at the provider's office. C. Inpatient antibody testing. And D. Community health fair rapid testing. The correct answer is A. At-home HIV self-testing kit because it allows complete anonymity. Oral swabs or blood spot cards can be used, and results are private, not reported to public health authorities. Option B, office-based rapid testing, and option D, community testing, are confidential but not anonymous since results are recorded and reported. Inpatient testing, option C, is highly controlled and also always reported. It's crucial to counsel clients about window periods. Antibody-only tests detect after 23 to 90 days, antibody antigen tests after 18 to 45 days, and nucleic acid tests after 10 to 33 days, though NATs require a physician order. Anonymous testing is limited to self-test kits, whereas confidential testing occurs in clinical settings. Question 55. Now let's consider a newborn scenario. A 1-day-old baby has not yet passed stool. The question is, what is the term for the very first stool of a newborn? Options are A. Melena, B. Meconium, C. Diarrhea, and D. Hematemesis. The correct answer is B. Meconium, which is a sticky, tar-like blackish-green stool composed of amniotic fluid, intestinal secretions, mucus, and lanugo. Normally, it should be passed within 24 hours in 99% of full-term newborns, and by 48 hours in all. Delay may indicate Hirschsprung's disease, Meconium ileus, or cystic fibrosis. Option A, melena, refers to digested blood from upper GI bleeding. Option C, diarrhea, is loose, watery stool unrelated to a newborn's first stool. And option D, hematemesis, is vomiting blood. Question 56. Moving forward to sterile technique, a nurse observes a student preparing for a sterile procedure. The question is, which action requires correction? Options include A. Reaches over the sterile field to grab sterile gloves. B. Sets the sterile field on a dry surface. C. Uses slow movements when arranging sterile drapes. And D. Keeps the sterile field at waist level. The correct answer is A. Reaches over the sterile field to grab sterile gloves, because it compromises sterility by introducing microorganisms from clothing or arms. Options B, C, and D are correct. The sterile field must be dry, movements should be slow and deliberate to avoid contamination, and the field should remain at waist level to stay within the line of sight. Remember, sterility is broken if objects touch non-sterile items. fall below waist level, or if nurses reach over the sterile zone. Maintaining sterility requires careful preparation, working in the line of vision, and minimal movement. Question 57. Next, let's discuss tracheostomy suctioning. When preparing to suction a client's tracheostomy, in which order should the nurse perform the following steps? The options are A. Test suction by aspirating a small amount of sterile saline. B. Identify client, perform hand hygiene, and gather equipment. C. Put on sterile gloves. D. Suction while withdrawing the catheter for no more than 15 seconds. E. Perform hand hygiene again, and apply PPE. F. Apply pulse oximeter. And G. Open the suction kit using aseptic technique. The correct sequence is B, F, E, G, C, A, D. First, Step B ensures client identification and safety. Then Step F monitors oxygen saturation. Step E involves donning PPE to prevent contamination. Step G opens the kit aseptically. Step C protects catheter sterility with sterile gloves. Step A checks catheter patency by aspirating saline. And finally, Step D performs suction during withdrawal, limited to 15 seconds. The Stancoast Pearl here is prepare, protect, perform. Prepare supplies, protect sterility and oxygenation, then perform suction safely. Question 58. Now consider a client with supraventricular tachycardia, SVT, on ECG. Which drug should the nurse anticipate? The options are A. Adenosine, B. Atropine, C. Labetalol, and D. Amiodarone. The correct answer is A. Adenosine, which is the first-line treatment administered as a rapid IV push with a flush. It transiently slows AV nodal conduction to restore normal rhythm. Atropine is used for bradycardia, labetalol for hypertensive emergencies or sinus tachycardia, and amiodarone for atrial fibrillation, ventricular tachycardia, or refractory SVT. The key pearl is adenosine equals AV node reset, but always have a crash cart ready, as transient asystole may occur after administration. Question 59. Moving to preventive care, the question is, the HPV vaccine is primarily recommended for which group? Options are A. Adults over 65 years, B. Pregnant women, C. Ages 11 to 12 years, and D. Infants at 6 months. The correct answer is C. Ages 11 to 12 years, which provides optimal protection before sexual activity. Vaccination can start at age 9, with 2 doses if initiated before 15, otherwise 3 doses. Adults over 65 are past the ideal age, pregnant women should avoid the vaccine, and infants are too young. The Stancoast Pearl is HPV equals high protection in preteens, preventing cervical, anal, and oropharyngeal cancers. Question 60. Finally, consider a client with hepatic encephalopathy and ascites. Which prescription should the nurse question? Options include A. Alprazolam, B. Rifaximin, C. Lactulose, and D. Spironolactone. The correct answer is A. Alprazolam, because benzodiazepines worsen confusion and increase fall risk in hepatic encephalopathy. Rifaximin reduces ammonia-producing gut bacteria. Lactulose traps ammonia in stool to lower serum levels. And spironolactone is a potassium-sparing diuretic useful for managing ascites. Remember the rule, HE equals no sedatives. Lactulose and rifaximin form the core therapy. Spironolactone manages fluid, and benzodiazepines must be avoided. Before we move on, listen closely. You, the future nurse, giving your all every day. I know the pressure, the sleepless nights, the what-if thoughts, but here's the exciting part. Your success is within reach. Stancoast Coaching is offering 70% off our online NCLEX crash course, the exact course that has helped over 10,000 students pass NCLEX on their very first attempt. Get interactive live classes, unlimited recorded lectures, detailed PDF notes, thousands of practice questions, NG and case studies, and a structured daily study plan. Imagine the relief, the pride, the joy of holding your nursing license and saying, "I made it." That can be your reality. Click the link now, grab your 70% discount, and let's conquer NCLEX together. Question 61. Now, let's begin by discussing acute glomerulonephritis. Which finding is most expected in a client with this condition? The options include A. Ketonuria, B. Hematuria, C. Polyuria, and D. Glycosuria. The correct answer is B. Hematuria, because inflammation of the glomeruli causes red blood cells to leak into the urine, producing the characteristic dark cola-colored urine. It is often accompanied by proteinuria, periorbital edema, and hypertension. In contrast, ketonuria is associated with diabetic ketoacidosis. Polyuria occurs in conditions with increased glomerular filtration rather than oliguria, and glycosuria is seen when blood glucose exceeds the renal threshold. Therefore, to recall AGN findings, remember blood plus protein in urine, swelling in face, pressure high, and always monitor intake, output, daily weights, and blood pressure. Question 62. Moving forward to insulin pumps. Which type of insulin is commonly used? The options are A. Rapid-acting, B. Ultra-long-acting, C. Intermediate-acting, and D. Long-acting. The correct answer is A. Rapid-acting, such as Lispro, Aspart, or Glulisine. This insulin allows pumps to deliver a continuous basal infusion plus pre-meal boluses to control postprandial hyperglycemia effectively. Ultra-long-acting insulin, like Degludec, provides prolonged coverage but is unsuitable for pumps. Intermediate-acting insulin, such as NPH, does not provide precise mealtime control, and long-acting insulins like Glargine or Detamir serve as basal coverage but cannot be loaded into pumps. So, remember that insulin pumps are all about speed-based delivery, using rapid-acting insulin for accurate control. Question 63. Next, consider a client with a chest tube whose water in the seal chamber fluctuates with respirations. The options are A. Finish counting respirations, B. Empty the water seal chamber, C. Assist with incentive spirometry, and D. Notify the charge nurse. The correct answer is A. Finish counting respirations, as this fluctuation, or tidling, is a normal sign of a patent tube and proper intrathoracic pressure changes. Emptying the chamber would break the closed system and is unsafe. Incentive spirometry is useful for lung expansion, but unnecessary for normal fluctuation, and notifying the charge nurse is not required. Continuous bubbling, however, is abnormal and indicates an air leak, so always monitor the water in the seal chamber carefully. Question 64. Shifting focus to heroin withdrawal. Which intervention best supports the client? The options include A. Administering antipsychotics, B. Providing a warm, quiet environment, C. Encouraging increased fluids, and D. Restricting caffeine. The correct answer is B. Providing a warm, quiet environment, because this helps reduce anxiety, agitation, and muscle aches common in withdrawal. Antipsychotics are reserved for severe hallucinations or extreme agitation. Encouraging fluids is generally supportive but not the primary intervention, and restricting caffeine can reduce restlessness but is secondary. Effective withdrawal management combines a calm environment with supportive care, and, if indicated, medications like methadone, buprenorphine, or clonidine. Question 65. Regarding insulin administration after giving 5 units of regular insulin and 10 units of NPH insulin, when should the nurse monitor for hypoglycemia? The options are A. 30 minutes after administration, B. 2 to 4 hours after administration, C. 4 to 6 hours after administration, and D. 10 to 12 hours after administration. The correct answer is B. 2 to 4 hours, which corresponds to the peak action of regular insulin. Rapid-acting insulin peaks earlier at 30 to 90 minutes. NPH peaks later between 4 to 12 hours. And long-acting insulins like Glargine or Detamir have minimal peak. Monitoring blood glucose during peak times is critical because hypoglycemia is the most common and dangerous insulin complication. Question 66. Next, for a client on mechanical ventilation with PEEP, which complication should the nurse watch for? The options are A. Decreased mean arterial pressure, SAP, B. Increased preload, C. Increased partial pressure of oxygen, and D. Increased gas exchange. The correct answer is A. Decreased MAP, since PEEP increases intrathoracic pressure, reduces venous return and preload, and lowers cardiac output. While increased PaO2 and improved gas exchange are desired therapeutic effects, preload actually decreases rather than increases. Hemodynamic monitoring is vital to ensure mean arterial pressure stays greater than or equal to 60 millimeters of mercury to maintain adequate organ perfusion. Question 67. Finally, in septic shock management, which finding indicates that treatment goals are being met? The options include A. MAP 67 millimeters of mercury, B. Urine output 20 milliliters per hour, C. Blood glucose 253 milligrams per deciliter, and D. Serum pH 7.33. The correct answer is A. MAP 67 millimeters of mercury, as maintaining MAP greater than or equal to 65 millimeters of mercury ensures adequate tissue perfusion. Urine output of 20 milliliters per hour is insufficient. Hyperglycemia, 253 milligrams per deciliter, is not a positive sign, and a pH of 7.33 reflects acidosis from lactic acid accumulation, indicating incomplete tissue perfusion. Therefore, MAP, urine output, lactate clearance, and mental status are key indicators of effective resuscitation in septic shock. Question 68 related hypoglycemia in a lethargic child. Let's begin with a situation where a child presents with lethargy and a blood glucose of 39 milligrams per deciliter. The nurse must act promptly. Here are the options. A. Recheck the glucose. B. Offer fruit juice. C. Give glucagon subcutaneous. D. Assess Glasgow Coma Scale. The correct answer is option C. Give glucagon subcutaneous. Severe hypoglycemia with lethargy requires parenteral intervention. Administering glucagon subcutaneously or intramuscularly quickly raises blood sugar and prevents further deterioration, as the child is not alert enough for safe oral intake. While rechecking glucose, option A, might seem cautious, it only delays urgent treatment, and offering fruit juice, option B, is unsafe due to aspiration risk. Assessing the Glasgow Coma Scale, option D, is helpful for neurological monitoring, but is not the priority over correcting life-threatening hypoglycemia. Question 69, related unconscious client without pulse. Moving on, consider a client found unresponsive and pulseless. What should the nurse do first? Options are A. Give 2 rescue breaths. B. Start chest compressions. C. Move client to shade. D. Ask another nurse to recheck pulse. The correct choice is option B. Start chest compressions. According to basic life support guidelines, high-quality chest compressions are the first priority when pulselessness is detected. Rescue breaths, option A, are important, but follow the CAB sequence, compressions first. Moving the patient, option C, delays critical intervention, and waiting for another nurse to confirm the pulse. Option D, wastes precious time. Question 70. See this positioning for lumbar puncture in child with AML, a 9-year-old preparing for lumbar puncture. Which position is correct? The options are A. Prone, B. Trendelenburg, C. Supine, D. Side-lying. The answer is option D. Side-lying. The lateral recumbent position with knees flexed and chin tucked allows spinal flexion, providing clear access to the lumbar interspace and accurate cerebrospinal fluid measurement. Prone, option A, may be used under radiological guidance but not routinely. Trendelenburg, option B, is for central line insertion or hypotension management. Supine, option C, prevents spinal flexion and is used only after the procedure to relieve post-lumbar puncture headache. Question 71. Now, let's examine myocardial infarction, an ECG of a client with suspected acute myocardial infarction. Which finding indicates an acute ST elevation myocardial infarction or SETEMI? Options A. Peaked T waves. B. ST segment elevation. C. Prolonged PR interval. D. Widened QRS complex. The correct answer is option B, ST segment elevation. ST segment elevation reflects full-thickness myocardial injury, signaling severe ischemia that requires immediate reperfusion therapy. Peaked T waves, option A, are more typical of hyperkalemia. A prolonged PR interval, option C, indicates first-degree heart block. Widened QRS complex, option D, may reflect bundle branch block or ventricular rhythms, but is not specific to acute MI. Question 72. Next, see this respiratory acidosis scenario. A client with chronic obstructive pulmonary disease has arterial blood gases as follows: pH 7.30, PaCO2 55 millimeters of mercury, HCO3 28 milliequivalents per liter. Which interpretation is correct? Options: A. Metabolic acidosis with partial compensation. B. Respiratory acidosis with partial compensation. C. Respiratory alkalosis with full compensation. D. Metabolic alkalosis with no compensation. The correct answer is option B, respiratory acidosis with partial compensation. The low pH indicates acidosis, elevated PaCO, 2 points to a respiratory cause, and slightly increased bicarbonate shows renal compensation that is still insufficient, confirming partial compensation. Metabolic acidosis, option A, shows low HCO3-. Respiratory alkalosis, option C, involves low PaCO2, and metabolic alkalosis, option D, presents with elevated pH. Question 73. Jump to kidney role in acid-base balance. In teaching about acid-base regulation, which student statement is correct? Options: A. The kidneys regulate acid-base balance by excreting carbon dioxide. B. The kidneys help maintain pH by reabsorbing bicarbonate and excreting hydrogen ions. C. The kidneys immediately respond to pH changes by altering ventilation. D. The kidneys maintain pH only by secreting potassium into the urine. Correct answer: option B. Kidneys are the long-term regulators, reabsorbing bicarbonate and excreting hydrogen ions to stabilize blood pH. Excreting CO2, option A, and immediate pH response via ventilation. Option C are lung functions, and potassium secretion, option D, is related but not the primary mechanism. Question 74. See this parathyroid hormone and calcium regulation. When teaching about PTH, which statement is correct? Options: A. PTH lowers serum calcium by increasing renal excretion. B. PTH increases serum calcium by stimulating bone resorption and enhancing intestinal absorption. C. PTH decreases calcium absorption in intestines and increases phosphate reabsorption. D. PTH only affects calcium via thyroid gland. Correct answer is option B. PTH elevates calcium by stimulating osteoclasts in bone, increasing renal calcium reabsorption, and indirectly enhancing intestinal absorption via calcitriol. Option A is wrong because PTH conserves calcium. Option C is reversed, and option D is incorrect as PTH acts on bone, kidney, and intestines, not thyroid. Question 75. Finally, I'm going to wrap up this series with our last scenario. A client with chronic alcoholism presents with confusion, tremors, and muscle cramps. Labs show magnesium 1.0 milligrams per deciliter. Normal, 1.5 to 2.5. Which complication should the nurse monitor most closely? Options are A. Hypotension and bradycardia. B. Cardiac dysrhythmias, such as torsades de pointes. C. Decreased deep tendon reflexes. D. Hypercalcemia with bone pain. The correct answer is option B. Cardiac dysrhythmias, such as torsades de pointes. Severe hypomagnesemia destabilizes cardiac conduction and increases the risk of life-threatening arrhythmias. Hypotension and bradycardia, option A, occur in hypermagnesemia. Decreased reflexes, option C, are incorrect because hypomagnesemia causes hyperactive reflexes. Hypercalcemia, option D, is unrelated. Hypomagnesemia can even cause hypocalcemia. Thank you, and see you tomorrow with our last test series 30